Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we're bringing you part 2 of the Sumo stance posterior pelvic tilting exercise for spondylolisthesis. These are extra methods to make it more effective and help with your spondylolisthesis pain. Hope you enjoy. So in part 1 of the Sumo stance, posterior pelvic tilting, we described the idea that in many cases with spondylolisthesis, we have these tight thigh adductor muscles on the inside of the thigh. And because of their attachments to the lower part of the pelvis and pubic bone, they have a tendency to pull the pubic bone down and lift the tailbone up, which accentuates the normal curve in the lower back, causing an increased curve and compression on the facet joints in the back of our spine and the back of the disc fibers, many times aggravating spondylolisthesis pain, because you remember in spondylolisthesis the vertebra has slipped forward, or an anterolisthesis, causing a natural compression on the back part of the spine to begin with. So what we talked about is, opposed to just stretching those tight thigh adductors out, which would be minimally helpful, we incorporate a posterior pelvic tilt because as we bring the legs apart and we get a natural stretch in there, if that stretch typically by pulling on those muscles accentuates the arch, we're going to counter that by tucking the tailbone under and lifting the pubic up. And as we do that, we're using abdominal muscles to pull that pubic bone up. That accentuates a mild stretch in the hip adductor muscles and gives us a more integrated way of correcting the mechanical problems that many times aggravate spondylolisthesis pain of the lower back. Today we're going to show you 2 different methods that we can add on to this basic stretch to integrate it even further. And that is the first one, when the legs are separated and you do have that tail under pull or accentuation of the normal stretch on the hip adductor muscles, after that is released, we can accentuate the stretch by side tilting our pelvis. So if we wanted to accentuate the stretch on this side, what we would do is, as we hold the tail under, after the first stretch released, we can then go for a second stretch by keeping the knees bent slightly and tilting our pelvis. So we're lowering our right hip and raising our left hip. Hip hiking, if you've taken any of the Pain Free and Fit or Posturesize videos or courses before. As we do that, as we swing our right hip down and left hip up, we're causing that pubic bone to move away from the leg and accentuating that stretch on the hip adductor muscles. That's going to increase it. Same thing as we did in the part 1 stretches, or any stretch, we're going to hold that for 15 to 60 seconds until that feeling of stretch fades away, and then we can go a little further by actually moving that pelvis a little bit further. Now again, when I do this, I don't want to disrupt any of my normal postural corrections in my body. If you notice, as I'm tilting sideways with my pelvis, my torso is following to the same degree. I'm keeping an equal distance between the bottom of my ribs and the top of my pelvis. I don't want to cause any aggravation to my spondylolisthesis pain by having a side tilting or a compression more on one side. I just want to tilt the whole body from pelvis through torso as a unit to accentuate that stretch. Keep in mind that you should be maintaining all your RPI or reverse posture isometrics as you do this stretch. If you don't know what a reverse posture isometric is, it's simply the mirror image or correction of your normal postural tendencies. If you haven't yet done so, you can go to either the Pain Free and Fit or Posturesize websites. We have a free body analysis there. You can learn about your unique posture and mechanical issues. We all have them. Most people with spondylolisthesis have them. They go unrecognized by many trainers, by many doctors even. And these subtle little corrections put into how to hold your pelvis and your rib cage, how to recruit different muscles like your multifidus, longissimus, iliocostalis, your internal obliques, makes all the difference with exercises trying to lessen pain, the healing exercises of the Pain Free and Fit system. So please go get that body analysis done yourself so you know how to hold your unique body as you're doing this or any other healing exercise. The second method we can do to increase the stretch or the challenge to this beneficial maneuver is to use an overarm pose. So as we separate into that sumo stance and we posterior pelvic tilt, after that stretch is released, we can then simply elevate our arms up. Now the higher our arms go, the more the natural tendency is to arch that lower back even more. So here we're using a stretch as opposed to directly on the hip adductors the latissimus muscles. The latissimus dorsi, or lat muscle, runs from our shoulder down into our lower back and pelvis. So as I elevate my arms, there's an even greater pull on the lower back to extend or arch it. So I need even more tail under tension, plus a little crunch down with my lower rib cage, as if I'm doing an abdominal crunch downwards. So I have both ends of the abs working here. I have the pubic bone coming up and the bottom of the rib cage crunching down to maintain that neutral spine, or that safe position in my lower back, as I feel that stretch increase in my inner thigh muscles. This is integrating multiple muscles that are contributing to the extension or the backward stress on the vertebrae that have the spondylolisthesis damage. If we're just focusing on one local area, we're not going to get the full effect of healing exercises as trying to integrate a more full body approach. So this integrates both upper body, mid body, and lower body muscles, all acting on that pelvis. When you get them all involved, stretched out to a more natural state, it's going to reduce the mechanical irritation on your spondylolisthesis and help with your spondylolisthesis pains. Hey, if you like this video, give me a thumbs up below. Help me share it with others that are needing this critical advice. If you have any questions or comments, please leave them below. I'll do my best to get back to you answering your questions about spondylolisthesis exercises or other healing exercises. If you haven't yet subscribed to our channel, we've got a lot of great other spondylolisthesis videos, healing exercises. As well, we have a great fast-track healing exercise program for spondylolisthesis on the Pain Free and Fit website. I hope this exercise and these modifications help you with your spondylolisthesis pain.